Okay, welcome everyone. Dr. Linder here. We are going to be looking at a continuation of osteology. In a previous video, we covered the axial skeleton, which is what we see on this slide here. The axial covered everything in the center. Think of it that way. We did the skull. We did the spinal column, the sacrum, the coccyx, the ribs, the sternum. We differentiated cervical vertebrae from thoracic vertebrae from lumbar vertebrae. We looked at the atypical vertebrae, how C1 and C2 were very different. And remember, the skull had all these different nooks and crannies to it. So make sure you review that. Today, we're going to be looking at parts of the appendicular skeleton. And we're going to focus on the upper extremity, which is what we see here. We're going to look at the clavicle. We're going to look at the scapula. We'll look at the humerus, the radius, the ulnar, the metacarpal, the carpals, the metacarpals, and the phalanges. Okay, we'll look at the upper limb. Then we'll do another video on another day, and we'll cover the lower extremity. Everything from the pelvic bone, the hip bone, the femur, the patella, the tibia, fibula, tarsals, metatarsals, and phalanges. Okay, so let's start with the shoulder girdle. When we look at now, shoulder girdle is different than shoulder joint, different terms. If we talk about the shoulder joint, we're specifically referring to this joint right here, the junction or articulation between the head of the humerus and the scapula. So they call it the glenohumeral joint. That's the shoulder joint, the glenohumeral joint. Gleno is for this depression right here, which is called the glenoid fossa or glenoid cavity. Glenoid fossa or glenoid cavity. And this part of the humerus is the head. So they call it the glenohumeral joint. That's the shoulder joint. But the shoulder girdle is different. The shoulder girdle is made up of this bone here, which is the clavicle, and how it articulates with the scapula and the sternum, this part called the manubrium. Okay. Now, there's a joint right here, this articulation between the sternum and the clavicle. And we call that the sternoclavicular joint. This right here is the sternoclavicular joint. And then there's another joint here, which is between the clavicle and this process called the acromion process. Acromion process. It's the highest part of the scapula, way up here, acromion process. So the junction between the acromion and the clavicular is called the acromioclavicular joint or the AC joint. Acromioclavicular or AC joint. This one commonly dislocates. Okay, and when it dislocates, what it ends up looking like is this high point on the shoulder, where when people touch or palpate the top of the shoulder, there's like a step off where this goes a little bit higher, and there's a bump that ends up forming here. They call it a step off type of appearance. And then here's the clavicle. Now the clavicle is a strut bone. What we mean by that, if you think of what a strut does, a strut is like, if you remember, oh gosh, like the original Star Wars movie, there's the scene where these walls are closing in and they try and use their hands and a bar to act like a strut to keep the walls from approximating and getting closer together, right? That's a strut. So you see that this clavicle, the strut bone, is going from the manubrium, which is in the front, to the scapula, which is on the back. And the purpose of this clavicle is to try and keep the scapula on the back of the rib cage. It's trying to keep it on the posterior part of the thoracic rib cage. So if this bone breaks or is non-existent, the scapula moves to the anterior, rotates around to the front, and gives you a very rounded shoulder contour. Okay. When we look at the clavicle, it has these two ends to it. It has an acromion end, and then it has a sternal end. And that's why when you look here, you see there's an acromial end, which is a little broader and flatter. And then it has the medial side, which is here, that articulates with the sternum. So they call it the sternal end. Okay. Underneath, right, on the inferior view, there's these roughened portions. One's called a conoid tubercle, and the other is called a costal tuberosity. These little knobby points are for ligaments to attach on the underneath surface. There are ligaments that attach underneath, okay, underneath the clavicle. So here's the scapula, here's the clavicle, here's the manubrium, there's the jugular notch. Don't forget this landmark right here on the sternum is called the sternal angle, also known as the angle of Louis, and it's always at the second rib. It's an important palpatory landmark because when you're listening to heart sounds or lung sounds, once you find that sternal angle, you don't want to put the diaphragm of the stethoscope over a bone. You drop down a finger breath. So you're on an intercostal space, and it's a lot easier to listen to breath sounds in those intercostal spaces. So we have a sternal end. Notice it's a little bit narrower. That's on the medial part. And on the lateral part, we have the acromial end. This is one of the most common fractured bones in the body. And it usually fractures right here, right? Where the medial part, this part is convex. Around 2/3 of it is convex. This is the anterior part. And then it starts to go concave right here. So right where that meets, it breaks and fractures, typically from falling with an outstretched arm, right? When you fall and you land with an outstretched arm, all of that force is transmitted upward into the humerus and right here into the clavicle, and then boom, it fractures right there. That's when you see people with their arm in a sling, keeping it flexed and in a sling to prevent movement because it's quite painful. Okay, and then on the underneath surface, again, you could see the conoid tubercle and the costal tuberosity. These are for ligaments that hold the clavicle down. Okay, now let's look at the scapula. Now, it looks like there's a lot going on here, but I'm going to help you organize the studying for this because there are many landmarks, and you can write this down. You can write these down. The way you should approach it is there are 3 angles. There's going to be 3 angles, 3 borders, 3 angles, 3 borders, 2 processes, 4 fosses, 4 fosses. Okay, so that helps kind of focus in on.
Professor?
Yes.
I'm sorry, but 3 angles, 3 borders. And can you repeat the last 2?
3. What did I say already?
You said 3 angles, 3 borders, but I forgot. I don't have the
4
last 2.
fosses and 2 processes. Okay, so when we look at the scapula, the first thing we look at is look at the left-hand side and then look at the right-hand side. One of the big differences that we see is that when we're looking at it from the anterior, notice how smooth this surface of the scapula is. But when we're looking at it from the posterior view, all the way on the right, it's not so smooth. We have this structure that crosses right through it. So once we see this line, which is called the spine of the scapula, I know it says spine here, but it's spine of the scapula. If you're ever asked this on a test, do not put spine, put spine of the scapula. So the spine of the scapula crosses through that posterior portion. So that's a key landmark. Once you see the spine of the scapula, we go, all right, we're looking at it from the posterior. Okay. Now, if we look at the spine of the scapula, follow me here, it goes from the medial border. It goes from the medial border and it goes superior and lateral. It goes superior and lateral till we reach that highest point. The highest point is the acromion process. The acromion process. Okay. Now that's one of the processes, and we could see it here on the left-hand side. Here's the acromion or acromion process. It's the highest part. And just next to it is the coracoid process. Coracoid process. Now the coracoid process is an important landmark. It's an important landmark because we're going to have muscles that attach there. There's going to be quite a few muscles that attach there. And it's important. I'm teaching you these landmarks because when we get into myology, you just don't have to know how to name the muscles, but one of the responsibilities and key factors to know and understand about these muscles is they move bones because they attach there. So it's important to know these landmarks because we have muscles that attach here. One of the muscles that attaches here is the pec minor. The pectoralis minor attaches here. So does a muscle called the coracobrachialis. Don't worry about the spelling for now. Just you can jot these down and look them up afterwards. The coracobrachialis. And if you look at that name, coracobrachialis, we see coraco from coracoid process, and then we see brachialis, meaning the arm. So it has to be going from here to the humerus. So we have pec minor that attaches here, coracobrachialis, and the short head of the biceps. The short head of the biceps brachii. The short head of the biceps brachii originates here. Okay, so those are two of the processes. Now, let's look at the borders. Let's look on the right, all the way to the right. On the top, we have a superior border. On the inside here, we have a medial border. And then on the outside, we have a lateral border. And it's easy to find the lateral border because it's where that glenoid cavity is. It's where that glenoid fossa is. It's where that glenoid cavity is, which is where the head of the humerus attaches to, which is here. If you look on the lower right, this is the lateral border of the scapula, and it's got to be lateral because it's at the same location as to where the glenoid fossa is, which is lateral. Okay, so again, we have a superior border, medial border, and a lateral border. Now, the other name for the lateral border, since it's near the armpit, is called the axillary border. It's known as the axillary border. Axillary here for axilla, armpit. The other name for the medial border, since it's closest to the vertebral column, the medial border is known as the vertebral border. Vertebral border. So in your books, whether it's the lecture or the lab, you'll see them used interchangeably. The medial border is the vertebral border. The lateral border is the axillary border. The superior border is on top. And that's true whether we're looking at it from the posterior view or we're looking at it from the anterior view. We have a superior border on top. We have a medial border, aka vertebral border. And then we have a lateral border, also known as the axillary border, because it's near the armpit, the axilla. Okay, so those are the three borders. We did two processes. We did three borders. Now there's three angles. Superior angle, which is the highest point. Inferior angle, lowest point. And on the lateral side is the lateral angle, which is really this point or this part of the glenoid fossa here, the glenoid fossa or glenoid cavity right there. This is the lateral angle. So again, superior angle, inferior angle, lateral angle. So we did two processes, three borders, three angles. Now let's look at the four fossas. Let's go to the picture on the right and let's find the spine of the scapula. That's a key landmark. Once we find the spine of the scapula, there's two fossas in relationship to it. One above it and one below it. The fossa above it is called the supraspinous fossa. Spinous because this is the spine of the scapula. It's a smooth depression above it. So we call it supraspinous fossa. And below it, we have the infraspinous fossa. Again, supraspinous fossa, infraspinous fossa. Only two fossas on the posterior, but there's four. The third is this on the anterior side. It's called subscapular fossa. Sub because it's underneath it. Subscapular fossa. And the third and final fossa is on the lateral view, the picture in the middle, where the head of the humerus articulates with, and that's called the glenoid cavity or the glenoid fossa. Glenoid cavity or glenoid fossa. Now, these three fossas, the supraspinous, infraspinous, and subscapular fossa, are important fossas because we're going to have three of the four rotator cuff muscles attaching there. You've heard of the rotator cuff muscles before. Many pitchers in baseball tear a rotator cuff muscle. People that have shoulder injuries sometimes need rotator cuff repair. So the supraspinous fossa is the origin for a muscle called the supraspinatus. The supraspinatus originates on the supraspinous fossa, supraspinatus muscle, supraspinatus. And below it, on the infraspinous fossa, is where the infraspinatus muscle originates. Infraspinatus muscle. You have a supraspinatus muscle and an infraspinatus muscle. They originate on their corresponding fossas. That's pretty direct and straightforward. And then on the anterior scapula, where we have the subscapular fossa, there's a rotator cuff muscle called the subscapularis. Subscapularis muscle originates here. The subscapularis muscle originates here. Subscapularis. Okay, so that's just some relevant information about the scapula, their landmarks, how to approach it, and the significance and importance of understanding landmarks. It's not just knowing the names of these bones and the names of these fossas, it's clinically really important in healthcare to understand them because there's so many conditions and injuries that involve those landmarks. Okay. So now let's just look at the anterior scapula. We know it's the anterior. How? Because look at the surface. It's all smooth. We don't see the spine of the scapula. So this fossa is the subscapular fossa. Let's look at the borders. Superior border, medial border, lateral border. So we have 3 borders. Let's look at the angles. Superior angle, inferior angle, lateral angle. Let's look at the processes. Coracoid process, acromion process. Now, I want to add 2 other tubercles. When you see the glenoid cavity right here, there's 2 little small bumps, one right here at the bottom or inferior end, and one at the top at the superior end of it. And we call them the superior glenoid tubercle and infraglenoid tubercle. Supraglenoid tubercle and infraglenoid tubercle. Supraglenoid tubercle and infraglenoid tubercle. Why are those tubercles important? Because they're attachment sites, again, for muscle. Your long head of the biceps originates here on the supraglenoid tubercle, and then your long head of the triceps originates here on the infraglenoid tubercle. Long head of the biceps here, long head of the triceps here. What's the other name for medial border? That would be the vertebral border. What's the other name for the lateral border? That would be the axillary border. Okay, so now we're looking at the lateral view of the scapula. Here's the glenoid cavity, and I'm glad they pointed that out right here on the top, supraglenoid tubercle. And then the infraglenoid tubercle would be right at the base. A little bit easier to see from this view, that would be right there. But if we looked at it here, superior glenoid tubercle, infraglenoid tubercle. Here's the glenoid fossa or glenoid cavity. It is very shallow. If you look at it, it's not a real deep depression. It really isn't. And that becomes a problematic feature because the head of the humerus, which is much larger, attaches here. And that's why there's so many shoulder injuries. The articulation between the head of the humerus and the glenoid cavity, it's not like a hip joint where it's super deep, it's very shallow. So that head of the humerus can dislocate in and out of that glenoid cavity. And when it does, it damages a lot of ligaments and muscles around it. From the side view, the lateral view, we could see the coracoid process in the front and the acromion process on the posterior. And again, all the way at the bottom is the inferior angle. Because we see the glenoid cavity, which is lateral, that's the lateral border, aka axillary border. From the posterior, again, superior border, vertebral border, axillary border, spine of the scapula. It goes from the medial border, it goes superior and lateral, that's the spine of the scapula, to the highest point known as the acromion or acromion process. The spine of the scapula is an important landmark because just above it is the supraspinous fossa, and just below it is the infraspinous fossa. Superior angle, inferior angle, lateral angle. lateral angle. Okay, let's pause here. When we come back, we'll get into the humerus.